Good evening. I'm Brian Thompson, Programs Manager at Can Do Multiple Sclerosis, and welcome to Your Whole Team, Your Whole Health, Decision Making in Multiple Sclerosis, part of the Webinar and Telelearning Series brought to you by Can Do Multiple Sclerosis and the National Multiple Sclerosis Society. We are excited that you're going to join us this evening. I will be your moderator this evening. We're joined by three renowned experts in MS care, and we invite you to be part of the program this evening. Can Do MS is an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. Through our programs, we empower people to manage their disease and move beyond their MS by adopting active and healthy lifestyle behaviors. Please visit the Can Do MS website, www.mscando.org, to learn more about our online and nationwide programs. We're excited to partner with the National MS Society to bring you 15 webinars in 2016. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. Explore the Society's programs, services, resources, and connection opportunities at nationalmssociety.org. Presenter is Dr. David Jones, a neurologist from the University of Virginia in Charlottesville, Virginia. Welcome, David.
Well, thank you so much. I'm excited about this program. Thanks, everybody, for joining. I hope that it really makes a difference for all of us.
Excellent. Thank you, Dr. Jones. Our second presenter tonight is one of our favorite consultants, the Vice President of Clinical Care at National MS Society, Roz Cobb. Welcome, Roz.
Thank you, Brian. I'm also excited to be here. I'm the psychologist on the team presenting tonight. I've been in the field of MS for 30 years and a proud member of the Can Do program staff for over 15, and I'm thrilled to be part of this team discussion tonight. Thank you.
Thank you, Roz. And finally, to round out our multidisciplinary panel this evening is Mandy Roehrig, a physical therapist from Omaha, Nebraska. Welcome, Mandy.
Thank you, Brian. I am honored to be a part of this team and have this conversation with all of you tonight. I've been a program consultant and a physical therapist for a little over 10 years right now. And I work primarily with folks who have MS in the clinic and to a lesser extent those folks who have balance issues. But again, very happy to be here this evening and look forward to having this conversation with everyone.
Excellent. Thank you. And thank you again for everyone for joining us. I'm going to turn it over to David, Roz, and Mandy. But again, please enter.
Roz again. You'll gradually get used to our voices. But tonight, what David, Mandy, and I want to do with you is talk about how you can identify key members of your healthcare team and understand the roles that each of them can play in helping you manage your symptoms. And we also want to provide some tips for how you can make the best use of your time with your healthcare team, because we know that that time is precious and never as long as we want it to be. And lastly, we're going to talk about how to come up with a framework for making decisions regarding symptom management strategies. We know there can be a lot of symptoms to deal with, and having a strategy to figure out how to work with them all along with your team is really important. So that's our goal for tonight.
So, in honor of the upcoming NCAA basketball tournament and also our founder, who is also a sports enthusiast, we have a theme of March Madness during our presentation tonight. So, to kind of give you a little background, our founder, Jimmy Huga, he is in that upper left-hand image there on the right photo, and then also in the center. He was one of 2 Americans to win an Olympic medal at the 1964 Olympic Games. However, unfortunately, by 1968, he was starting to experience some very early symptoms of multiple sclerosis with a diagnosis in 1970. You know, I was really privileged to get to meet Jimmy early in my relationship with Can Do. I recall him sharing his story when we sat at the table that first meeting, and he explained how when the doctors diagnosed him, they told him in short to just rest and don't overdo. And I recall Jimmy saying, in these colorful words, might I add, that he just wasn't going to rest. He was a highly trained athlete. He was going to continue to exercise despite the recommendations of the time. So fortunately, Jimmy was an instigator. He was someone who led the investigation into exercise for people with MS. And now fast forward to 1984, Jimmy founded the Hugo Center, which is now Can Do MS, with the intention of inspiring people living with MS to focus on what they can do. And Jimmy realized in order to do what you can do, that requires a team. And just like all of these hardworking players that we know are going to be competing in the upcoming NCAA basketball tournament, that using your team to the fullest potential requires a lot of strategy. And that strategy allows you to achieve the optimal success that you possibly can. And using each basketball player or player of your MS team when you need them will help you maximize your ability. So in essence, just remember that you're not alone in managing your MS, and in fact you have a really awesome team working for you. So again, to kind of display and illustrate this relationship between March Madness and multiple sclerosis, the NCAA tournament has 68 teams, and in multiple sclerosis it often feels like you have 68 symptoms, right? And if you're lucky, you get to advance to the Sweet 16 in the NCAA tournament. And fortunately, we have at least 16, nearly 16, but nearly actually 13 disease-modifying therapies to choose from. The Elite 8 often feels like 8 medical appointments a week. It's intense, but you like to go, you need to go. And the final 4 is 4 differing opinions, maybe from family, maybe from friends, maybe from your healthcare providers. And then lastly is that championship game. So how do you make it to the finals? How do you achieve success? What offenses or defenses, what players do you need on your team to best help you manage your MS at every stage of the game or every stage of the disease?
So one of the adages in sports is that we need to define who the leaders are. And I would argue that successful sports teams are very good at doing this. And I think one is the team captain, kind of the general, so to speak, on the playing field or the basketball court. And I think in MS that needs to be the person that actually has the disease. And I really think of them as the most valuable player. And often, but not always, they are accompanied by a primary care partner whose voice can also be very important in deciding what decisions can be made. And certainly without the players on the field, it's hard to win the game. And the coach I think of as a neurologist who should be on the guideline, but should be on the sideline, but should really be coordinating all of the efforts so that the team captain can play the best game possible and hopefully end up with victory or success, however that is defined. There are other members of the team potentially as well. An MS nurse can be a very valuable member of the team. And often I find that physicians and nurses and other healthcare providers have very different trainings. Other folks that we may call in off the bench if needed, often very early in the game, may include a psychologist like Roz, a social worker, a physical therapist like Mandy, an occupational therapist, a speech pathologist, a nutritionist or a registered dietitian, maybe even a urologist, a physical medicine and rehab specialist known as a physiatrist, a primary care doctor, and vocational rehabilitation. The idea really is to find the best members of the team and put them on the court so they have the best chance of being successful. So one of the questions is for everybody, who are the members of your healthcare team? And I think Brian's going to lead us through a poll here to see how many folks use different members of the team.
Thank you, David. So yes, we'll have a number of polling questions throughout the night to get your participation. So we'd like to start off just to find out who you access as part of your healthcare team. So you can click on as many of the choices as are applicable. It can be multiple answers. So go ahead and click who's part of your healthcare team, then click Submit, and then in a minute here we'll check the results.
We need some Jeopardy music, Brian.
Yeah. Well, they're coming in real quick. We have about almost 300 responses. We'll give it a few more seconds here, but this is a great way to find out how everyone at home is doing and who they're accessing. So this is an important part of our webinar process. We'll give it a few more seconds here. They're coming in. And yeah, let's see what we have here. So certainly overwhelmingly, a neurologist, as David had mentioned, as the coach, is a big part of our team. But we also get to access a lot of other members. So I don't know if three of you want to chime in on some trends, or is this pretty common with what you see out in the field?
So this would meet what I would expect to see out in the field. I think that most often the most common healthcare provider is the neurologist, as we see here. I'm glad to see that almost half as many folks are having input from an MS nurse, which I think is wonderful. And unfortunately, as I expected, we're seeing lower numbers from some other members of the team. Not every member of the team is required for every person with MS or for every event, as we may speak. Certainly I'm glad to see that there is a variety of people being, specialists being used to help people with MS to maintain their or play their best game. So one of the challenges, this is a bracket that's probably going to be going through every office in the U.S. relatively soon. And I believe there still are 64 teams that enter it. And usually there are 4 divisions. And for reasons I never quite figured out, sometimes there's one division that seems, or one bracket, so to speak, that seems stronger. And often in multiple sclerosis, the disease management, what DMT, what drug, what injection are you taking, gets most of the press. But it turns out that with MS you may need to play in any of these brackets. And for people with MS, the most important bracket to them may be issues with cognitive and emotional symptoms, issues with physical symptoms, issues with the social impact of the disease. And I really think to have the best chance of success and to have the most meaningful victory, so to speak, with this, we really need to be sure that we focus on teams or on issues in all 4 of these regions or these sub-brackets. And I would argue that many times we don't focus enough on symptom management. It may be a few symptoms, it may be a lot of symptoms, but certainly there are a lot of members of the team that can help with this. And supported by your care partner, your co-captain, your coach, you can help identify the symptoms that are creating issues and getting some improvements, some resolution, and hopefully some feeling of success at tackling these symptoms.
So it's really, really overwhelming when you look at the slide that MS and this disease can cause all of these different symptoms, right? So from the top of your head down all the way down to the tip of your toes, you can experience something because of your MS. While many people won't experience all of these symptoms, a lot of people will over the course of their disease. So what's really actually important is that you know that these symptoms can be caused by your MS, and that when they do occur that you need to and should report them to your healthcare team, especially those symptoms that might be interfering with your ability to function, whether it be physically, socially, or emotionally. Now, I'll let you guys read this, but when trying to explain your multiple sclerosis symptoms becomes more annoying than the symptom itself. Wow, right? Sometimes it's really difficult just to explain your symptoms to your healthcare team, not to mention your family or friends. It's terribly challenging, particularly since so many MS symptoms are not visible. The horrible fatigue, or the fact that every minute you're worried about where the nearest bathroom is, or the slowed thought, slowed thinking, or just the unbearable pain. It's really difficult to explain that variety of symptoms.
I think that it's really important to recognize that your ability to communicate about your symptoms is sort of the key to success. So even though you're the team captain and the leader, you as the person who's living with MS, even the best player on a team has to communicate effectively with the coach and the rest of the team. So communicating what you're experiencing and how it feels is that very first step to getting the help you need to manage those symptoms. No matter how good your neurologist is, and trust me, David is an excellent neurologist, he can't read your mind, and no matter how much your family or friends love you or care about your well-being, they can't read your mind either. So it's very important not to hold back. If you're not sure whether a problem is caused by your MS or not, don't worry, just ask. That's your neurologist's responsibility and your primary care physician's responsibility to help you sort out which issues might be related to your MS and which aren't. And also, I have to say there's really no room for embarrassment with this disease. In one of my very favorite movies of all time, A League of Their Own, Tom Hanks says to the women on his team, "There's no crying in baseball." Well, in MS, there's no shyness, right? With your healthcare team, they've heard it all. You don't need to worry about being embarrassed to share that you have some problems with the bladder or bowel or mood or cognitive changes or any of the other things that people may find it difficult to talk about, sexual problems. The healthcare team in MS is familiar with all these and ready to help you manage that. And the more you share, the more they can help. Now, there's one other tip that's really important here, and that is that you're the only one who can prioritize those symptoms, right? In a relatively short visit with your neurologist, you may not be able to discuss every single symptom that you've had in recent months. But if you keep track of your symptoms over time and then you think to yourself before you go to your appointment, okay, what do I really want to make sure we tackle today? What's most important to me? What's getting in the way most in my daily life? Then you can talk to your coach and set the priorities for your visit because, as David said, you're the captain. If you would like more information about MS symptoms, because we're not going to be able to go into detail about all of them tonight, you can access information and publications related to each of these symptoms on the National MS Society website, and I encourage you to do that. So now we're going to meet the captain and co-captain for tonight. I want to introduce you to Sally and Stan. Sally is 45 years old, and she's now had MS for 15 years. She's married to Stan, and they have two lovely teenage daughters. Sally's recently had a severe relapse, which has caused some new symptoms. She's got excruciating fatigue, a lot of stiffness or spasticity in her legs, so that she's having some difficulty walking. She's got increased numbness in her feet and hands, and she's been experiencing some new bladder urgency and frequency that's interfering with her activities at work and at home. And lately she's also felt as though she's got some brain fog. She doesn't really know how to describe it other than that, but some brain fog that seems to be interfering with her work activities and some of the things she does at home as well. Dr. Jones has prescribed steroids to help Sally get through this relapse more quickly, and the steroids have provided some relief, and he's also discussed some treatment options. They've talked a little bit about whether to change her disease-modifying therapy, and they're talking about symptoms. Sally and Stan, are very concerned with all these new symptoms and what they mean for her today and down the road, and that the symptoms are impacting her work and her family life. Stan has said to Dr. Jones that he's especially worried, and he just wants his wife back. He says that there's so many changes going on that he's not quite sure who Sally is right now.
All right, excellent. So now we'd like to know which team members you think that Sally and Stan should consult as part of their healthcare team. So thinking about the scenario that Roz laid out before you, what advice would you give to Sally and Stan as far as which teams and which players should be part of this process? So go ahead and vote for as many as you'd like, and the responses are coming in fast and furious. So we'll see where we're at, and that's going to adjust as people come in. And there's a big spike I see in urologist. Not too many people.
And the psychologist, I'm really happy to see.
Yeah.
Yes.
Sure.
It's like a neck. Maybe this is horse racing and not basketball. It's almost neck and neck. Nice.
Well, I really think this is great to see that there already is a realization that many members of the team can offer some benefit and can help us as we start the first half that is MS. And often one of the first persons that is met is the neurologist that may actually make the diagnosis. And often after the diagnosis, there's a long discussion on what disease-modifying therapy is appropriate. And it's really easy for this to dominate the discussion. And it's really easy for disease-modifying therapy to become a ball hog and not let anything else shoot the ball, so to speak. So I think it is really important that after this discussion is had, that we move on, and we talk about things that the team captain, the person with MS, and or the person. So I think it's important that the disease-modifying therapy be discussed, and then the symptoms of MS be discussed as well. And this conversation should be listened to, should be initiated, and should be demanded by the person with MS and the caretaker. In this situation, Sally is really concerned about fatigue, spasticity, mood, depression, and cognition. This can take a long time to cover, so actually being able to prioritize which is most important is necessary. As Roz said, even though maybe I'm a great neurologist, I can't read Sally's mind. And fatigue can mean very different things to different people. A slide I like to show, one is a med student pulling an all-nighter that has a espresso in his or her hand and looks very tired. The other is somebody that just ran a marathon and is out of breath with their hands on their knees, and they also look very tired. Most people with MS actually have a different description of fatigue. They usually describe physical lassitude or walking through quicksand or having cinder blocks tied to them. So I think one of the really important things is to define specifically what the symptom is and ensure that both the coach, i.e. the neurologist, and the person with MS, i.e. the team captain, understand what's going on and are speaking the same language. Because if the language or the definitions are different, progress probably is not going to be made. Sally tells me right off that her fatigue is overwhelming and that the stiffness in her legs is uncomfortable. Once again, I need to understand specifically what she means by both of these before I can take a stab at treating them. Obviously, mood, depression, and cognition can all play a role in other symptoms as well. Certainly there can be discussion on disease-modifying therapies, but I'm a bit on symptomatic therapies, but I'm also a big proponent of wellness priorities, physical, emotional, intellectual, spiritual treatments as well. And it is clear, even though 20, 30, 40 years ago we told Jimmy not to exercise, the data really supports the value of wellness and exercise in MS. So I think we have somewhat of a game plan with Sally, and we're going to try to prioritize her fatigue, spasticity, and mood. So which play should we execute? Which team players can best help Sally and Stan? One of these may actually be the physical therapist, i.e. Mandy, and bringing her in the team can be extraordinarily valuable to meeting the goals that we're trying to achieve.
Thanks, Dr. Jones. So I'm really glad that Sally and Stan come together to Sally's first session with me. And as Dr. Jones commented on, exercise is really, really important. So what we do initially is establish a good exercise plan for Sally. And there are 4 components, as you can see, to this exercise plan that we have for her: aerobic exercise, flexibility exercises, strength training, and balance. And right now we have these bubbles relatively the same size, but at different times of her disease, some of those bubbles may need to be larger or are emphasized more than others. But this slide represents just a very basic general guidelines that we have for Sally and that may be appropriate for some of you. So we'll briefly just speak to each one of these bubbles. The first one is aerobic exercise. So this is anything that gets your heart and lungs going. So maybe riding a bike or water aerobics. It can help with deconditioning, which can often be a pretty significant factor to MS fatigue. Aerobic exercise also, as in an earlier webinar back in January, we talked about how aerobic exercise can be helpful to manage cognitive issues in folks with MS as well. So a couple reasons why aerobic exercise is going to be a really big component for Sally. The next one is flexibility. So flexibility exercises are also critical to her program to help her manage her spasticity. As her PT, I will help her identify which muscle groups need stretched and which of those that don't. I just simply don't want her wasting her valuable energy on exercises that aren't doing her any good and addressing her problems. So in addition to that, prescribing specific exercises, I would probably also encourage her to check out the National MS Society. It has resources, specifically 2 stretching manuals, one with examples of nice images and descriptions of exercises that can be done independently, as well as those that can be done with a partner. The next component is strength training. So again, some general recommendations there. But I think for Sally, we would focus on specific muscles that are limiting her with her walking, so that may be compromising her walking. Again, we don't want her doing exercises that aren't going to give her bang for her buck, if you will. Lastly is balance. So because Sally specifically hasn't expressed a lot of concerns about balance and denies any fall history, this is probably the smallest bubble of all. This will be least emphasized. But for all of your benefit, balance exercises are generally highly individualized and really based on specific functional deficits. So a good example might be, say, Sally would have difficulty walking in the backyard or on an uneven surface. Then doing some types of balance exercises on cushion or foam or really tricky carpet might be appropriate for Sally to do. So again, I think what's important to note about this is that these are guidelines and more or less may be appropriate for Sally and may be appropriate for your situation. So again, really appreciative that Dr. Jones sent Sally and Stan over to me. But in addition to a good exercise program, we really want to dig a little bit deeper into her specific needs and her specific challenges. So the first challenge that she articulated was fatigue. Now, one of the members of the team that I would probably pull in would be the occupational therapist. Occupational therapists, particularly those who specialize in multiple sclerosis, are the leaders in the management of fatigue. So they would definitely talk to you about the 4 Ps play or the 4 Ps basketball offense that you need to be running. And that is planning, prioritizing, positioning, and pacing. And in brief, this means planning would mean just planning ahead, organizing your day that in such a manner that would allow you to do all of the activities that you need to accomplish. Prioritizing, just as it sounds, is essentially prioritizing the activities that need to be done first so that you're able to get done with the essential items. Next is positioning. So logically speaking, sitting will conserve a lot more energy than standing. So if you can sit to prepare a meal, that may be better than standing to prepare a meal, as an example. And lastly is pacing. So we use kind of the energy budgeting concept. So if you're going to exert yourself or exercise or participate in grocery shopping, then maybe after grocery shopping you allow yourself a little bit of a seated rest break to kind of refuel and re-energize a bit. So kind of that balance between exertion and rest is what pacing means. Something else Sally can consider to help her manage her fatigue would be body temperature. I've read, and Dr. Jones can certainly confirm, that as little as 1/10 of a degree, so very little temperature change in your core body temperature can cause fatigue and certainly exacerbate MS symptoms. So in that corner you can see that image of the gal wearing some examples of cooling products that may or may not be helpful for Sally, but I'd certainly expose her to them. We spoke briefly about appropriate exercises for her. And then lastly, if in addition to these more conservative management ways, we talk to the MDs and talk to the physicians, talk back to Dr. Jones and see if there are any other medical issues that might be contributing to it. Maybe she has very poor sleep hygiene. Maybe she has inadequate nutrition. Maybe some medications are contributing to fatigue. But the team as a whole, and as well as the person with MS and their support partner, we all kind of have to be detectives and try to figure out what might be the primary causes of this person's fatigue and Sally's fatigue. So the second one is spasticity, and again we've already spoke kind of how we would manage Sally's spasticity, but stretching is certainly important, and positioning devices. So for example, sometimes wearing, and it will use the example of drop foot. So drop foot, sometimes you can get a really tight calf muscle in the instance of drop foot, and sometimes using a brace can help to counteract some of that spasticity in the calf muscle that might be contributing to it. But in the situation, if we would use a brace, we would often pull in another team member, and that team member would be an orthotist. And an orthotist is a person who makes braces, and often it's appropriate for someone in this situation to need a custom, perfect fitting brace to help manage her spasticity. And again, if these strategies aren't enough, we might call Dr. Jones again to see if other medications, maybe baclofen or other interventions such as Botox injections, might be helpful. And then lastly, but certainly not least, is Sally's concern with her walking. I think what's important is that the most important goal, rather, is that Sally can keep walking safely with the best quality for as long as possible. And this will involve specific exercises, maybe introducing assistive devices such as a cane or a walker or some type of a brace. I will be certain to emphasize to Sally that these are aids. They're tools that are going to help her walk and make sure that she can walk to the best of her ability. And one device might be appropriate for one time, but may not be appropriate for another, and that's okay. That's okay. They're all tools, and again, we investigate and work together to try to find the ideal situation and the perfect fit for her. But the overall goal, again, is to make her as functional as possible with the least amount of equipment. So we had a great session. We really had a great session, but at the end of it, Stan mentioned to me that she's been feeling really down and her mood is very low, and that he's really encouraged and wants to support her in this new exercise endeavor, but he's really concerned that she will not follow through with the recommendations. So clearly, even though Sally isn't quite ready to deal with her mood, Stan, the support person, is really concerned. So I tell them as a couple that mood changes are extremely common in MS, and it's certainly nothing to be embarrassed about. In fact, depression can be one of the most common symptoms in multiple sclerosis. So really kind of diving in and figuring out what might be going on mood-wise would be a really important priority. So when people are feeling depressed, it can make their MS symptoms feel worse. So a referral to a mental health professional might really be appropriate. So I asked Sally and Stan if it's okay if I talk to Dr. Jones about this concern that they brought up. And I would go ahead and call Dr. Jones and again ask Sally and Stan if there are any other issues that they wanted me to bring up with Dr. Jones when I'm on the phone with them. I just think it's important to recognize to bring up other issues with other members of the healthcare team, even if they're not necessarily who you would think would be intuitive to help you with that problem. And then if that's not helpful, then certainly you can call the National MS Society and they can be a quality resource for you as well for any referrals.
So I'm so glad that Stan mentioned his concern to Mandy and that Mandy forwarded those on to me. Just like in a basketball team, you'll see many members of the team will converse with each other on the court and help try to work together to win the game, so to speak. And I think this is very true in healthcare, and I am hugely appreciative when I hear from other healthcare providers, physical therapists, rehab specialists, urologists, whatever the case may be, about getting other input about the patient, the person with MS. One of the challenges is the neurology appointment is often relatively brief, and they often don't occur all that often. But physical therapy tends to be a longer period of time and more frequent interactions. So there may really be a better amount of information and a better understanding of everything that's going on with Sally. So it's great that Mandy helped Sally get comfortable with the idea of speaking with me for a referral. I was able to give her a referral, the name of a psychologist who has worked with other people with MS. But certainly if that doesn't work, calling the MS Society for other names of providers can be very helpful as well. I really think that it can be hugely beneficial for people with MS to see a psychologist with some experience dealing with other people with MS, because sometimes the challenges may seem somewhat unique.
So thank you for the referral, David. I'm very, very happy to see Sally and to reiterate what she's heard from Mandy and from you, that mood changes are extremely common in MS. Depression, anxiety, moodiness, or irritability are something we see very commonly, And it's very, very important to figure out what's going on and what's causing them, because they can result from several different aspects of the disease. It's certainly not surprising that a chronic unpredictable illness could make people feel a little cranky or a little down, and the challenges of living with this kind of disease can wreak havoc on moods occasionally. But we also know that these mood changes are more common in MS than they are in other chronic illnesses, and that they're not just a reaction to the challenges of life with MS, they're also caused by changes in the brain and in the immune system. So they are part of the disease process itself. And as Mandy said, we know depression, for example, is one of the most common symptoms of MS. So it's important to give these mood changes as much attention and care as you would your spasticity or your fatigue or your bladder problems, because they're symptoms that need very careful diagnosis and treatment. And so with Sally, we're able to talk about the things that she's been feeling lately. We can sort out what's the normal, natural grieving process that occurs when a person is diagnosed with a chronic illness and they experience changes in the things they're able to do, changes in their lifestyle. All of that involves some grieving. But in addition to that, Sally is feeling quite down. She's lost interest in things that have been fun and interesting for her in the past. She just can't get really involved in things the way she used to, and she feels as though her mood is down most of the day, every day. And so we are going to talk about treatment strategies to help her with that depression. We not only want Sally to feel better, but we want her to be able to function the way she did before. And when we adequately treat depression in somebody with MS, it often happens that their other symptoms actually feel better, because one of the things about depression is that it can make fatigue feel worse, it can make pain feel worse. All those other symptoms just feel more challenging when you're also depressed. And that brain fog that Sally talked about, we'll talk about more in a minute, is also very common in MS. But one of the things we know is that when you're depressed, that can interfere with your cognition. So the first thing we want to do is get Sally's mood better, deal with the depression, because it may be that some of her other symptoms, including that brain fog, will start to feel better. And the good news is that depression and anxiety are very treatable symptoms of MS. We know that talk therapy is effective, particularly cognitive behavior therapy, which has been studied extensively in MS. We know that there are very effective medications for people who need them as well. And as Mandy alluded to, we now have great data demonstrating that exercise that's geared to a person's abilities and limitations can also improve mood, as can good stress management strategies. So Sally and I have a lot of work to do together, and we're already forming our own little sub-team here as we work to help her feel more like herself again, so that she can deal with these other challenges of living with MS.
So Roz and Sally have been having some great sessions, and one of the things that Sally talks about with Roz is that she's very discouraged about her weight. So we want to give Sally a quick timeout tip about working on her weight gain with respect to her MS. She has always been really physically active, loved hiking, riding her bike with Stan and their girls. But as her MS symptoms have worsened, she's certainly become less active. She snacks more to deal with the fatigue and the low mood that she's now experiencing. And she just simply does not like her body much and feels extremely discouraged. So Roz and I put our heads together and we came up with a plan to help Sally get her weight back on track and get back to help her get back where she wants to be. Sally and I tweaked her exercise program, worked on establishing some goals for herself. We got a referral to a registered dietitian from Dr. Jones so that she can start working on nutritional goal setting, meal planning, and some ideal tips for healthy snacking. And then Roz and Sally just continued their conversation about mood and coping strategies that can be effective for managing weight gain. But both Roz and I also start talking with Sally and Stan both about the importance of SMART goals. So SMART goals stand for specific, measurable, achievable, and realistic, as well as timely. SMART goals are kind of like the smart basketball plays. They're the smart offenses, the smart defenses that work well when they're executed. They really lead to great success. So we'll give some examples of some good quality SMART goals in an upcoming slide.
So Sally and her team continue with the game plan. And over time it seems that Sally is having fewer relapses and is slowly transitioning into secondary progressive MS, is developing slowly worsening walking, and she also finds that it's interfering with her ability to get to work and function as effectively as she once did as an insurance agent. She also finds that this is starting, MS is starting to further interfere with her quality of life. She notes some bladder challenges, including urinary incontinence, that is causing more isolations, causing some issues with intimacy and her relationship with Stan. So in addition to just talking about what are we going to do to manage the primary disease, there also needs to be a lot of discussion about what are we going to do to manage the symptoms of Sally's disease, and what are we going to do to make her as functional and continue to play the best game that she can with the disease that she is fighting. So what players from the team should execute the next play for Sally? Who should we involve?
Excellent. Thank you, David. So now there's an opportunity to recognize what a SMART goal is, specific, measurable, realistic, and timely for Sally and Stan. So we put together three options that they could do to address their situation. One is modifying their home, for example, a stair glide that would go from the living room down to the basement. 2 new schedule management strategies to help their family manage their schedules, and to exercise together twice a week for 4 weeks. Or are they all SMART goals? So what would you recommend if you were a part of this healthcare team? What would you recommend for Sally and Stan? So we'll let some of the responses come in. Let's see what we have here. See, most people think that they're all SMART goals. So, team, how do you feel about that?
So I think that's absolutely appropriate, and certainly they're not. All of these things are important potential SMART goals. So we continue to talk about the challenges of secondary progressive MS. Which in some ways becomes more of a defense than an offense, so to speak. Part of it is managing the MS as a whole, and one of the challenges is it's less clear how we should manage disease progression later on in the disease, which I find is a frustration for many folks with multiple sclerosis. But that doesn't mean that there's nothing we can do. Quite the contrary, there's a lot we can do in patients or in people with secondary progressive MS. Much of that is in regard to rehabilitation with physical therapy, occupational therapy. Part of that is with fatigue management, with exercise, with wellness programs, and mood and cognition as well. I think that trying to maximize functional mobility continuing to keep moving, even if that requires some of the adaptive equipment that Mandy talked about earlier, whether it requires some mobility equipment. And certainly a mobility device does not mean that somebody can no longer walk. It may just be a tool to be able to do more. And throughout this, maintaining a solid and consistent exercise routine, really tailored to the individual with multiple sclerosis, often with the assistance of a physical therapist or a exercise physiologist. So the hope is to continue to recruit other members of the team to address all of the issues. Two big issues that Sally brought up affecting her include bladder dysfunction and including some of the cognitive challenges that she is having at work.
So we're going to talk about Sally's cognitive issues now, but I just want to point out that like mood changes, cognitive issues are very, very common in MS. As you see on the slide, up to 65% of people with MS are going to experience some cognitive changes, but they can occur at any point in the disease course. They can be even the first symptom of MS. So I encourage people to pay attention to their thinking and memory, and if anyone feels that changes are interfering with their functioning at work or at home, it's important to bring it up whether you were diagnosed a month ago or 5 years ago or 10 years ago. It's important. These cognitive changes we know are a primary reason why people leave the workforce, along with fatigue. They're probably the most common reason that people stop working. So the earlier these changes can be diagnosed, and the earlier people can learn the compensatory strategies they need to manage whatever changes they're having, the better able they are to continue in their roles at home and at work. Cognitive changes can affect all kinds of very personal and important parts of us. A lot of us, the way we think and the way we feel and how our brains function is central to our sense of who we are. So when people start to experience cognitive changes, it can impact self-esteem. It can impact communication with other people, making oneself understood, remembering important conversations, and generally just communicating the way one wants to. So relationships, daily activities can all be affected by cognitive changes, as can self-care. And if you put, low depressed mood together with cognitive changes, being able to take care of oneself, execute smart goals, engage in planning and problem solving, all of those things are impacted by these mood and cognitive changes I've been talking about. The kinds of cognitive changes that can occur in MS typically include a slowing of information processing. So people can still think and do the same things, but they describe it as feeling like they have molasses in their brains. It just takes longer to think, remember, to come up with words, to problem solve. People have trouble learning new information and holding onto it in memory. What we know about people with MS is that if you give them enough opportunity to learn something in the first place, enough repetitions, they will remember it just fine. But frequently in everyday life, you don't get that extra time to learn something and store it in memory. So people report a lot of problems with memory, and then some issues with visual spatial skills, directions, following written instructions, that sort of thing. So these cognitive changes deserve very, very careful assessment, and those assessments can be done by neuropsychologists, by speech-language pathologists, by occupational therapists. Not all of those clinicians all do cognitive work, but again, you can get a referral to one of those specialists who's able to evaluate cognitive functioning. And what's important about a good assessment is that it helps you understand what your strengths are, as well as where you've had some changes or losses. And then the person you're working with can tailor compensatory strategies that take advantage of your cognitive strengths to compensate for whatever changes you've experienced. So you get the tools that you need to be able to function effectively at home and at work. Assessment of her cognitive changes, and also working with her to find strategies that can help her continue to be successful at work and in managing our household. But I also noticed while we're working together in our sessions that she's repeatedly getting up to use the bathroom. And so I asked her if it would be okay with her if I got back to Dr. Jones to talk about the cognitive retraining that we've been doing, but also to talk to him about what seemed to be really important bladder issues for her so that she can get a referral.
So thank you, Raj. It's certainly always good to get feedback from every member of the team, what is going on with Sally or any individual with multiple sclerosis. And certainly bladder dysfunction is very common in people with multiple sclerosis, affecting up to 85% of those with MS. Obviously, this can be a very embarrassing symptom to discuss, even though it can be a very important issue, as it can lead to social isolation. It can also potentially lead to other complications, including bladder infections, including skin breakdown. So it absolutely is an important issue that should be discussed, obviously, in a professional and caring environment. Certainly bladder dysfunction can coexist with sexual dysfunction, and for some people intimacy is a very important part of their relationship with their care partner. Bladder dysfunction can involve several different issues. Most commonly it's a failure to store urine, often by a hyperactive bladder wall or detrusor muscle, which can cause a sensation of urinary urgency and can lead to accidents with the bladder. There can also be issues when it's difficult to empty the bladder. Somebody may sit there for minutes before the urine stream starts, or they may notice that the urine stream comes and goes and doesn't remain strong throughout the void. And sometimes folks may notice that they walk out of the bathroom and they walk right back in and pee some more. Certainly these two aren't mutually exclusive. Sometimes there can be issues with an overactive bladder wall and a spastic sphincter muscle. There are medications for these issues, but the first order of business is to determine specifically, is this a failure to store urine or a failure to empty urine. I often start with behavioral strategies. For urinary urgency, time void, setting the internal clock or even the iPhone clock. It's 3 hours. I usually get urgency at every 3.5 hours, so I'm going to go to the bathroom. I don't empty my bladder very well, so I'm going to try to reinitiate or get more urine to come out before I leave the bathroom. Some different pelvic floor exercises like Kegel exercises can be helpful, as can avoidance of bladder irritants like caffeine, alcohol, spicy foods, and the like. Sometimes folks need to do intermittent self-catheterization to get their bladder empty, but often folks will have seen a urologist or at least an MS nurse before doing this. I will caution folks that people will, with bladder dysfunction from MS will often restrict the amount of fluid, but this can worsen fatigue. It can potentially worsen constipation. So fluid restriction is usually not a great idea for people with MS, although it may be reasonable to do in the last several hours before going to sleep. to try to prevent waking up multiple times a night to pee. Timeout, certainly keeping mobile is extremely important throughout the course of the disease. Just like a car that parks for too long, it may not go. People with MS that park themselves too long may have trouble getting going again. Mobility can involve many different things. It doesn't require normal walking. Certainly exercise can be involved with this. Assistive devices can be helpful. And team members that can help include the physician and his or her nurse, a physical therapist, and an exercise physiologist. Other advantages of keeping mobile is it can assist with weight control, because certainly excessive weight can interfere with mobility. But throughout this, safety is of paramount importance because a fall leading to a fracture could really rob independence and really be a tipping point or a turning point, so to speak, in a patient's disease.
So, you know, I think it's clear from all the subjects we've touched on tonight that MS is the kind of disease that can really feel overwhelming at times. You've just got too many balls in the air and too much to deal with. We hope that the conversation tonight has shown you the benefits of teamwork. You working with your team members and your team members communicating with each other. You're really not in this alone. The more difficult things seem to be, the more you need to rely on your team. Your healthcare team and the National MS Society and other MS organizations who can do MS and others are all here to help. And in addition to the team members you've heard about tonight, remember that you can call an MS navigator at the National MS Society to answer your questions, refer you to helpful resources, and connect you with service and care managers who can help you identify and coordinate members of your team if you're having trouble doing that. So don't hesitate to advocate for yourself. As the captain and co-captain, your goals and priorities determine the plan, and we can help you execute that plan successfully.
So to just reiterate, what is your MS decision-making playbook? Speak up and communicate. Communicate to your healthcare providers and take action. Advocate for your needs. Prioritize your needs. Teamwork, as Roz so eloquently just said, you know, the power of the team is always greater than the individual. So huddle up with your team during hard times. Find those team members that you need. And don't hesitate to contact the National MS Society for those referrals if you don't feel like you're able to find those referrals on your own. Other options for ways to help you find that team, even if you're not in a comprehensive MS care center or in a community that has a lot of resources, you can still make this team. Ask your healthcare providers for their recommendation. You can also consult with other professional organizations. Call us here at Can Do MS. Call the Consortium of MS Centers, the professional organization of the American Physical Therapy Association or the American Occupational Therapy Association, or any other professional organization usually has a network of individuals that they could refer you to. And then lastly, consider alternative modes of communication. You know, you might find a great mental health professional, but unfortunately she lives in Maine. And that's okay. Maybe you can communicate via email. Maybe you can communicate in a telehealth kind of a webcam type of a manner, but you can still have those effective relationships with all members of the team. So in summary, just remember you're not alone. You have a playbook, and most importantly, you have a team.
Excellent. Thank you, Mandy. And to sort of wrap up this evening, now that we've talked about all the different players and the different disciplines that go into making decisions on a daily basis, moving forward, what player or discipline moving forward do you think you will add to your team to have a really well-balanced and comprehensive decision-making process. So it's our last poll question. So we'll see what are some people's goals moving forward. And I think it's really interesting that nutritionist and dietitian is really high. We actually got quite a few questions on that, and a few questions about an OT, which is occupational therapist, and that's also someone that people are looking to add to their team. All right. Well, thank you, everyone, so much for your participation. That's what really makes our webinars work, is a dialogue back and forth. And thank you so much to David and Mandy and Roz for all your expertise and for just a really broad, comprehensive look at just every decision that you make with MS. It requires so many different disciplines. So we touched on a lot today. So we have a few minutes left for questions, and so again, in that bottom left-hand corner, you can certainly type in your questions. Unfortunately, we don't have too much time left, so we'll be able to get to a few of them, but not too many. And I guess the first question that I'd like to ask the panel, and anyone can chime in, towards the end, you talked a lot about access and how to find the different specialists. That's definitely the most numerous questions that we received, was how do we find these specialists? Psychologists and nurses, a lot of people asked for, but actually the most was for nutritionists and dietitians. And one viewer pointed out that only 7.4% of the viewers were utilizing a nutrition and dietitian, but when we recommended what Sally and Stan should do, almost 25% said that's what they should go see. So clearly there's a disconnect between what should be available and what people are actually accessing. So any other advice as far as accessing a different specialist? Specifically, another person asked, if they're not, if the different specialists aren't near each other, how do you get them to communicate with one another?
So this is Roz, and I'm going to take a stab at answering that first. I think it is important to call the National MS Society 1-800-FIGHT-MS. Because in many areas of the country, we can help you identify these specialists. Now, obviously, not every area of the country has all of them, and we've ourselves been bemoaning the lack of nutritionists and registered dietitians who have particular expertise in MS. But I think that any registered dietitian can help you figure out weight management strategies, healthy snacking, eating that can help manage fatigue. Plus, we have a lot of information on the National MS Society website that provides guidance for you around healthy nutrition. So I would start by calling the society to see if they can help you pull together the team of people that you want. And as Mandy said, they may not be right there in your town, so you may need to arrange to talk to some by phone or by email. And when your team members aren't all in the same place, they also can connect with one another by email or telephone. Technology can work if team members are willing to function like a team. You need to convince them that you need them to be talking to each other for your benefit. That's how you can advocate for yourself.
Excellent. Well, thank you very much. And Mandy, this may be a good question for you. You talked a lot about aerobic exercise and how important that is. And we have one viewer ask, aerobic exercise raises your body temperature, yet that exacerbates fatigue. Please address this conflict.
Yes, it certainly can do that. So I agree that that can be a challenge for some folks. Generally, what we do is either structure the exercise program in such a way that we don't allow the exacerbation of symptoms during the aerobic exercise, and or usually a combination of both. We have people partake in types of cooling strategies. So having a fan blowing on them while they're exercising, drinking plenty of cool fluids, wearing some of the cooling devices. It's not uncommon here in the PT clinic that I have patients wearing a cool pack around their shoulders while they're doing aerobic exercise, just to allow them to perform to the best of their ability and still participate successfully in the exercise.
And I would just throw in that water exercise can be a perfect solution because people can get a lot of aerobic benefits exercising in the water while maintaining their body temperature. So swimming or water aquatic exercises can be very popular. Plus you can socialize while you're doing them.
Absolutely.
Absolutely, but I would be aware there are some rehab facilities that have warm pools, which may be great for folks with fibromyalgia or folks with orthopedic injuries, but the warm pools may not be great for people with MS, especially those that have issues with heat intolerance.
All right, thank you, everyone. Dr. Jones, you spoke a lot about bladder issues and incontinence. We had one viewer ask, what causes that loss of bladder retention? When they go from sitting to standing, their bladder will empty without warning or any urgency.
So the bladder actually, even though it just seems like a balloon, there is a fair amount of neuronal control or control of the nervous system to keep us continent and to keep us dry and only to pass urine when we want to. And sometimes just the bladder anatomy, when we stand up, there is some more downward pressure and some change in the gravitational pull into the bottom or the neck of the bladder. And sometimes that position change can lead to issues with incontinence, especially if there is weakness of the muscles of the pelvic floor. And these are muscles that can be hard for us as individuals to isolate, but they actually are muscles that can be strengthened with the assistance of a physical therapist that specializes in rehabilitation in the pelvic floor, or the doing Kegel exercises and other rehab modalities. One of the other challenges, sometimes people are walking around with much more urine in their bladder than they know when there's issues with emptying. And certainly it may be the change in position suddenly makes them aware that there is a lot more urine in there than they thought, and can lead to urgency or can lead to incontinence. And like I mentioned before, bladder issues can have some significant effects beyond just the embarrassment to social isolation, and bladder infections can be serious. Skin breakdown from sitting in urine can be serious. Urinary retention in folks that cannot empty their bladder correctly can be serious. So bladder dysfunction is more than just an embarrassing phenomenon. It's one that should be addressed for quality of life and for good health.
Thank you, Dr. Jones. We have time for one more question, and I'll direct this one towards Roz, who is our specialist in working with support partners and including them in the decision-making process. But of course, Mandy and Dr. Jones, if you have any comments, please chime in. We have one viewer who asked, as the co-captain, I used to be far more patient and supportive. With time, however, I'm afraid I've become more prone to a short fuse and to criticize because I don't perceive the captain doing all he can to help himself. We now argue all the time, which is stressful and thus harmful to the captain. Do you want to maybe kind of address that, which I appreciate the viewer using our captain, co-captain analogy.
Sure, it's wonderful. You know, I think that tempers can get short under the best of circumstances, and living with a challenging illness like MS is not always the best of circumstances. I encourage couples to talk to a therapist or a counselor and learn some strategies for how to communicate, particularly in those tense moments, in ways that allow each person to hear the other and to respond without tempers getting in the way. I also want to put in a word that I should have said before when I was talking about mood issues. It's not just the person with MS who is vulnerable to mood changes. We know that depression and irritability and are also very, very common in support partners or co-captains for a different set of reasons. But I think we often don't pay enough attention to the strains and stresses that co-captains live with. And I would encourage all of you out there who are support partners, or as we call them, co-captains, to pay attention to your own mood and think about whether your short fuse or your irritability or anger could be some depression in yourself that needs some attention. You too are dealing with changes and losses that are not within your control. But I think communication strategies, finding a comfortable setting in which to try to get your communication back on track is really the way to start, so that you can do some goal setting together, some problem solving together to ensure that your partnership stays balanced and to ensure that you are working effectively together to maintain your quality of life. It's not just about the person with MS, it's about the whole family and about keeping your partnership healthy. So I wish you the best with that. That's where I would start.
Excellent. Thank you, Roz, and thank you, Mandy and Dr. Jones, and thank you everyone for joining us this evening. As we conclude tonight's program, I'd like to inform you of some additional resources that you may find informative and helpful. On the Can Do MS website, you will find all our archived webinars, including tonight's webinar. Starting Thursday, it will be on our website, so anything that you missed tonight, please go back and watch. We also have a monthly e-news program that you can sign up for, as well as a series of library articles that are available both in the written form, and we also record them as audio recordings. If you go on to that website and look at our library articles, there's a great article on MS management decisions written by David, Roz, and Mandy for you to view. And also we had lots of people ask questions. Unfortunately, we didn't have time to address all of them, but we have a great program called Ask the Can Do Team where you can submit a question, and we'll try to pass it on to one of our MS experts from across the country to send you an answer. So please send your questions on our website there. And then also the National MS Society, who we're partnering with for tonight's webinar, has a number of wonderful resources on their website, nationalmssociety.org. And specifically there's some literature on different therapies as well as making treatment and lifestyle decisions. There's a great video there and a whole section on comprehensive care. And again, we'll send you these PDF slides, and you can get that website and access those resources. So again, thank you so much for joining us tonight. As always, you can register for the Webinar and Telelearning Series free of charge on the Can Do MS website, www.mscando.org. Our next webinar will actually be a week from tonight. We've been doing an employment series for people with MS, and it's a 4-part series, and next Tuesday will be part 3, which is the complete guide to Social Security disability with some great experts. So please join us next Tuesday. For those participating live tonight, you will see a survey appear on your computer screen. We have a new survey format, so please take a moment to complete the survey and share your input. Your input helps us continue to improve our Webinar and Telelearning Series. And again, you will also receive a PDF copy of tonight's slides by email. So thank you again for joining us, and thank you to David, Roz, and Mandy for sharing your expertise. And we wish you all good night and good health. All righty, and we're out.